Hello students, I would like to share with you this story about my aunt, which serves as a case scenario for today's lesson. So my aunt is a 70-year-old who has multiple medical conditions such as diabetes, high blood pressure, amongst others. On and off, she will have blood during her bowel movement. Yes, I'm referring to the toilet time. A general practitioner suggested that she should go for a colonoscopy. The scope with camera at the end goes up her bottom into the large intestine to find out any abnormality or growth that caused the bleeding. So the GP recommended two specialists for my aunt's consideration, Dr. A and Dr. B. My aunt consulted Dr. A the following day. Dr. A performed a series of tests such as blood tests and CT scan, given her complex medical history before advising her to go for colonoscopy in a week's time. The doctor informed her that colonoscopy procedure requires sedation and carries a small risk of bleeding or tearing the colon wall. When queried, Dr. A revealed that there had been a couple of cases of such complications under him. She doesn't like what she heard. The bill that was presented to her after the first visit was $1,005 as a private patient in a restructured hospital. As for the second doctor, Dr. B, there was only one case of complication whereby there was a hole made in the colon during the procedure over his 20 years of practice, and that was because it is a complex case because the patient had a history of stroke and was wheelchair bound. Considerably a very good track record for Dr. B. However, after finding out my aunt's history of medical condition, Dr. B, who worked in a private practice, advised my aunt to just simply change her diet to plant-based diet and drink more water. If excessive bleeding continues, she should consider consulting other doctors, as given her age, he wouldn't want to perform the colonoscopy procedure on her. The bill that was presented to her after the first visit was $150. Worried of the possible excessive bill size, my aunt consulted her insurance agent, who advised her to see Dr. C. It is a panel doctor under her insurance scheme. Dr. C examined my aunt and subsequently made arrangement for colonoscopy procedure in 3 days' time. The bill that was presented to her after this first visit was $200, including consultation and also some medication that she should take before the colonoscopy procedure. Now, my aunt seeks my advice as to which doctor she should continue seeing. If you were me, which doctor would you suggest to my aunt?